Very warm welcome to you all. I'm Tessa Guthridge. I'm chair of the Young Dementia Network, and our focus today is the importance of social care for people with young onset dementia. Really pleased to have with us Julie Hayden, former social care worker and now living with young onset dementia, and Professor Jan Oyebode, University of Bradford, and there are presenters and panelists today. Just a reminder that you're not on video or audio, but we do encourage you to use the chat as much as you want. And of course, please do put your questions for Jan and Julie in the Q&A box, and we will leave a chunk of time at the end for responses to those questions. First of all, though, we wanted to start with a short film of Julie in conversation with Helen Young, who's part of the Dynamic Project team at Bradford. And this is to bring out Julie's experience, both as social care worker and as a person with young onset dementia, and her experience of social care now. So let's start with that film, and then Jan will follow up to tell us much more about the project and the resources that are going to be available.
Can you tell us a bit about your experiences of social care since you were diagnosed with young onset dementia?
Well, when first diagnosed, what tends to happen is that you get an automatic referral to a social worker initially to do an assessment of needs.
Yeah.
But then, given that you're at the start of your journey, it will be unusual for any services to be made available to you because you are at that early stage. So basically you tend to get, well, I was told that, you have no needs because I could wash myself, dress myself, feed myself, and I was walking around, so I was fine. So there was no further input, and it was, although not expressed as such, kind of a, okay, go away and come back when you're worse kind of thing, which isn't very helpful, because you concentrate on the physical, you're missing out on so much more. Dementia is very much, to a large degree, an invisible condition. And so there's so much more happening, which if you get in with early intervention, you then empower that person to be able to remain active and independent for an awful lot longer before they start to rely on heavy input or service needs. So not only is it better for that person, it works out better for social services because the cost of any support is cheaper, because if you wait until someone is at the point where they're needing a full-time care support package or needing quite a hefty amount of care, or certainly if you're waiting around until you're called in to prepare an emergency care package, that's a hell of a lot more expensive. So the aim is to keep someone as independent as possible for as long as possible, and then also that builds towards the fact that even if that person eventually goes into full-time care, that will be a shorter amount of time that they're reliant on that what's a very expensive care provision.
So taking you back to the time where you were told you didn't qualify for the support, how did you manage in that situation? What what did you do to try and overcome that?
Well, pretty much because of my social work background, knew what was coming. So sort of wasn't surprised really. But the problem was that because there was no input whatsoever, it meant that I had to rely on my own mettle as to going out there and finding out what was right for me. Because with dementia generally, because most people are older, when it's young onset, even if you try to access the local groups around you, it's mostly people who are very much older, different stage of life, different family setup and home environment, and what happens is that you end up speaking to care partners, but there's no sitting down and speaking to someone about, well, I'm in this situation. How do you manage, say, you might have dependent children still, you might be trying to hang on to a job, those kind of issues, which you wouldn't have in later life.
Yeah. So there must have been times during the time since you were diagnosed where you felt you needed perhaps some aids or adaptations or something in the home. Have you found that easy to get hold of, or have you found that support?
I think there's been no support because with other conditions, you tend to get referred to physios and OT to make those assessments and bring in the right equipment. Because it was dementia, I didn't get referred to those services. So as my balance became more of an issue and I became less mobile, I was having to go out and try to find my own way through those problems and find out what might be useful to me. And sometimes I made right decisions, luckily, and sometimes I made wrong ones, and the wrong ones are very expensive. And that becomes an issue because, I was relying on benefits.
Yes, of course. So thinking about the support that you found most useful, I know you mentioned to me before that often peer support is something that you found really useful.
Yeah.
Can you talk to me about how you got some peer support?
Well, initially, like I said, I was going around to the groups which existed, but they were all set up around the needs of much older people than myself. And at that time, we still had an Alzheimer's Society office locally. And so I went back to them and said, is there a place for people of my age to meet and talk? And they said, oh no, there isn't anything. So at least I had the professional experience of being involved in facilitating groups and things like that. So I said, well, in that case, I'll open up my own young onset group. So I did that. I went out and I researched and I found a place that was suitable, that wasn't going to be too clinical, that was going to be accessible, and that was fairly central. And so what we could do is have that place for people to come to. And, we were only, because we were a minority group of people among people with dementia, we were never going to be made up of a vast number of people. No. It was only a small group. But it turned out to be really useful because you had that ability that when people came in, because it was a small group, they felt it much more easier to talk and express what they were going through. It became a bunch of friends who would meet up socially rather than a formalised group that was managed.
Yeah. So thinking about how it should be, are there perhaps one or two things that you'd like to mention about how it should be for somebody living with young onset dementia and their families?
It would have been really nice if there was some named worker that I could stay in touch with, because the dementia services right across the country are so split between different groups. It's rare to find any dementia pathway somewhere. So it's kind of older person services, it's mental health, it's frailty services. And so trying to find anyone to relate to who can, like, say, if you had a Macmillan nurse and you had cancer, they will be helping you liaise between the different groups. And if you were lucky enough to have an Admiral nurse, then they will be helping you navigate that way through. But most areas don't have Admiral nurses. We need an awful lot more. And so it would be nice if there was someone who was going to stay connected, because at the moment you only have intervention from the social worker for a short period of time, and then they close the books. And it's a case of, if you need anything from social care, get back in touch. Then you've got to be speaking to a different person, going through all over again your history and explanation of how you are. If you could go back to the same person who met you before and say, well, this area is more of a struggle now, and I would find this helpful, that would mean a smoother path through. And that person would or should be able to know who are the right people to deal with that situation and signpost you up.
So, following that interview with Julie speaking about her experience and being able to speak from both sides of the coin because of her career in social work, as well as now living with young onset dementia, I'm going to follow on by telling you something about the resources we're going to introduce today and how they were developed. And I think Julie's account has so much in it. But one thing it really highlighted was the lack of awareness of the social worker that Julie was first referred to, who was geared up to provide support for people who might need help with some of the basics of daily life, but wasn't as geared up to think about the wider areas, which, as Julie says, are often invisible to someone unless they know something about young onset dementia and its distinctive nature. And as Julie pointed out, if people think holistically, but also if people are able to or have the capacity to plan proactively, from a social care perspective, you may be able to provide someone with those means of retaining their contribution to society, retaining their independence for that bit longer and avoiding crises. So it's better for everyone all round. So I've put some slides together and I'm going to see if I can share my screen with you. I'm hoping you can now see my slides. And what I'm going to do is try and take you through a bit of the story of how we came to focus within this project on this area of looking at whether we could do something to help social care staff be more aware of the needs of young onset dementia. And I thought because in a way, I suppose the resources that we'll show you, our short animation and a backup leaflet, are outputs at the end of a 2.5-year project. They look like small outputs resulting from all that work, but we do think that they're based on a firm foundation. And what I want to do is show how we tried to build that foundation in order to put our efforts where we thought we could try and be helpful and make a difference. So I'm going to say something about briefly about the context of social care provision, tell you a bit about the dynamic project itself, and then move down to the focus we came to on awareness of social care staff and how we developed the resources. And then we'll finish by showing you the animation before we open up for discussion. So in terms of the context, if you've chosen to come, I know that most people will be well aware of what social care is and how it's defined. Although, as we've learnt during our project, the UK, the way we divide things in the UK into healthcare on one side and social care on the other isn't universal. And we did have to explain to our colleague Christian Bakker, who's on our advisory group and works in the Netherlands, what this division is about. So social care in the UK is formal social care is a responsibility of local authorities, and it's care that helps people live independently and stay safe and well. And it involves that support for basic activities like getting up and dressed, having your meals, and so on. But it also covers support to stay active and engaged. And it should help people to establish and build connections so that they still feel part of mainstream life, and it helps people maintain their function. And of course, social care, unlike healthcare, isn't free at the point of delivery. So we know that only people with the highest needs and the lowest level of financial assets receive state support, and other people have to fund themselves and may rely on self-help, but can still benefit from the direction of people working in social care, because those people working in social care may be able to signpost people towards really useful resources and services. So we had been involved in a previous research project about young onset dementia called the Angela Project. And in that project, we had been given over 850 examples of good support, positive support people had received, both people living with young onset and their family supporters. And we tried to classify these 800 and so examples of positive support to think about what underlying needs those were meeting, which made them particularly helpful. And on the screen here, you can see the 8 needs that we distilled everything down to. And you can see that some of them are to do with specialist services, like number 1 and number 4. But a lot of the others are really more in the arena of social care. And it highlighted to us just how important social care is. And it led us to apply for the grant for this particular project, the Dynamic Project. And its long title is Social Care for People with Young Onset Dementia and Their Family Supporters, Current Practice and Resources for Improvement. And the study's funded by the National Institute for Health and Care Research through their programme for social care research. And the little disclaimer here is the official one that we need to give to say we're expressing our views, not those of NIHR or the Department of Health and Social Care. So this project aimed first of all, to understand the social care experiences of people living with young onset themselves and their family members, and also to understand things from the other side of the coin. What is the current state of practice of people working in social care? And then we wanted to bring those two aims together to go on and produce recommendations and resources to improve social care. So the project has run for 2.5 years. It began in April 2023 and it finishes this month. We found out about the experiences of people living with young onset themselves through qualitative interviews with people in our first work package. And we found out about the current state of social care practice with young onset dementia from a national survey of people connected with social care across England. And so from these two work packages, we were able to bring them together using a method of analysis called convergence analysis to look at what the key themes were that crossed over these two sides of the coin or highlighted issues that went across these two different perspectives. And this led us to a set of key themes which were important. And we took those to a big meeting with stakeholders and had a discussion about which should be set as priorities for the rest of our project. That led to two priorities, one of which was awareness of social care staff, and the other of which was helping people have strategies to better meet financial needs, which is the topic of next month's Young Dementia Network webinar. And then with those two priorities, we looked at what was already known about how to meet those priorities, and we moved into co-producing the resources that we're going to show you. So that's the project in a nutshell. So in terms of the focus on awareness of social care staff, awareness came out as a key theme. And first of all, so the visual image I've put here is to show that we were wanting to build these firm foundations so that whatever we did was something that had really grown from the ground upwards. So in our first work stream, where we heard from people with young onset dementia and family members, a number of people told us about the concern they had if social care staff weren't aware about the nature of young onset dementia. And we had one example of a man who was referred to a social worker with his diagnosis of young onset dementia for an assessment of needs. And the social worker assumed that because he had a diagnosis of dementia, he would be housebound, confined to his house. So the participant asked for a prior warning of any visits so that he could be in. And the reply was, well, you should be in. And he said, well, I go out. And the social worker said, well, you shouldn't be going out. You've got dementia. And he said, well, I need to go and do my shopping. So obviously a lot of social care staff are far more aware of young onset dementia and its needs than in that example. That's an extreme, but that's one incident that we were told about when we interviewed our participants. And in the blue box here, you can see our conclusion from the social care survey that many social care professionals felt that they lacked the knowledge and confidence that they would like to work well with people with dementia. Many people were working in adult social care and didn't often see someone with young onset dementia. So not surprisingly, they didn't have experience with many people or many households living with the condition in order to gain the experience and expertise they felt they needed for the issues to be familiar and to help people. So social care awareness had come up both in the interviews and in the survey. And when we did our convergence analysis across these two areas, the better awareness came out as one of 6 key areas where both sides felt that there could be some improvement. And we took those 6 key areas to a stakeholder meeting where we had a big discussion about them to try and decide where to focus for the rest of the project. And that was the meeting that took us into focusing on awareness as well as on improving strategies for managing finance. Of course, we're not the only people who've raised this issue, and just flagging up here that Tide, Together in Dementia Every Day, did a survey of almost 100 carers of people living with young onset dementia and found the lack of knowledge in health and social care staff was a common theme too. So the priority we set around awareness was this. We phrased it like this. Our goal is to raise awareness of social care staff around the care needs of people with young onset dementia and their families. Our aim was to develop a resource or a set of recommendations to improve knowledge and awareness of young onset dementia for social care staff. And within that area, we're considering the needs of the South Asian population as well as the wider population. And the reason we focused on that area is because it did come out within our interviews and within our workshops as the South Asian population being mentioned as one where stigma of dementia was particularly great and where it might be incumbent on staff to know how to engage with people and make sure they were offering something culturally appropriate as well as age appropriate. So having decided on that focus, what did we do about then focusing in on that area and co-producing the resources? Going back to building towers, I hope they're not ivory towers, you can see that having decided on this focus, first of all, we wanted to look at what's already known about how to raise knowledge and awareness, because we didn't want to just reinvent a wheel. And then we thought, as well as looking at what's published or reported about this, we would also talk with people face to face. So we interviewed 13 professionals with knowledge or expertise in the area, and we were able to pick people's brains about their good practice and think about what advice they might offer us that we could capitalise on and try and spread more widely. And then, armed with that information from those 2 steps, we went into the co-production process with a small group of varied people. So I don't want to say too much about what's already known, what we discovered when we went to do our literature review of what's already published in reports or in journals. But when you get the slides later, you could read this in more depth if you'd like to. But basically, there is really very little published on how to improve knowledge and awareness of young onset dementia in social care. There is some knowledge about how to deliver effective dementia training, and there is a recent Alzheimer's Society report from last year that summarises that very well. And we also found that there was research evidence that social care staff who have opportunities for training must feel more motivated and happy in their roles because they have a lower turnover than those who receive less regular training. And it looks as if learning and development are one of the top 3 retention factors for social care staff. When we talked to the 13 professionals, they told us that formal training around young onset dementia tends to be sketchy, if any, and superficial because there are so many training demands. And they had some ideas, some helpful ideas about how material on young onset dementia could be woven into mandatory training, such as training on risk or induction training, so that you can convey some information about young onset dementia without it being the central topic of training. But they also felt that training often works best when it's clearly practice focused and when it's related to a situation that staff are currently dealing with. But the professionals also stressed a lot of other ways of gaining awareness. So it wasn't that they were expecting that the only way you gain knowledge is through going on a training course. People talked about how much they learnt from people who were experienced in the area, either colleagues in their team or people working in specialist services external to their team, but people they could get in touch with. They learnt a lot through talking with a supervisor in their regular supervision sessions. They learnt from being able to shadow or visit a service that offered something to support people with young onset dementia. Some people were in a service where they had a monthly meeting devoted to young onset dementia, talking about current families they were working with, and that was seen as useful, and so on. So it wasn't necessarily formal training. It meant that we didn't necessarily need to be thinking of devising an online module because there are other ways that people learn. And I'm sure that probably would ring true with a lot of people who have come to our webinar today. Here's someone saying it comes through experience. I think, you know, my social worker who's left, this is her colleague, I think she wasn't always a young onset. Young onset needed a service. She opted in and then she learnt from the experience. A bit like mine, you know, you learn through experience, isn't it? And here's someone who raised the issue of having the ability to provide both person-centred and culturally informed care. For me, it's about that family network and some of the cultures around family and supporting family. So I think it's just that cultural awareness that the workforce needs to be mindful, and how that can interplay and impact the person with dementia's experience of receiving care, the caregiver's experience of giving care, but also how you work with the family to sort of help them to develop a care plan that kind of meets the needs of everyone in that sense. So with that background information, we then established a co-production group. And in addition to Julie, who's part of our project management group, Helen, the dynamic project researcher, and those of us in the research group, we were able to call on 5 people who gave their time and their advice and expertise to help us shape up the resources. So our group included someone from the third sector, someone from a specialist service, a social worker, and some people with lived experience or experience as a carer. And we held just 2 online meetings with the co-production groups, one in July and one in September. So one at the beginning of the process and one as we were still going through. And in between times, we consulted via email exchanges at other key points along the way. And we've had huge background support from Dementia UK. We were able to include in our bid some funding to have 10 days worth of time, and that's been fantastically helpful. So in our first co-production meeting, we wanted to focus on who to target in terms of raising awareness, what format to use in our resources, and what key messages to try and convey. So this is a slide we used at the first meeting. And I've put a strip on the bottom with what the outcome was. And we knew we needed to be realistic because we only had about 3 months ahead of us in the project, and we had about £3,000 of budget to go towards the resource. And we knew that we could do something that was only modest, but we wanted it to try and hit a spot that would be helpful. So the outcome of that first discussion was a decision to target social workers, because social workers were seen as such a cornerstone, such a linchpin for people to get good support. So it was felt that social workers were a very influential group, but one who just had to spread themselves across so many conditions that they might not have the chance to know a lot about young onset dementia. And we decided in that meeting that we needed a resource that would be eye-catching and not take too much time. And that's how we arrived at the idea of a short animation. But as the social work member of our group said, this also needed some backup information to go behind it, so that if we caught someone's eye with the animation, they knew they could go and find out a little bit more about what might be helpful from that backup information. So our resources consist of the short animation and a leaflet that I think runs to 12 pages in the end, with backup information in it. So the whole process of co-producing the animation was very interesting. I'm towards the end of my working career, and it's the first time I've been involved in producing an animation. We needed at the beginning to identify the basic parameters. So, for example, there is evidence that to catch someone's attention and give them a message that they may absorb, you need to keep it really brief. And when I was involved in producing some online modules for e-learning for health for the Dementia Training Standards framework a few years ago, we were told to keep any videos to 4 minutes, but now we're told to keep it to 1.5 to 2 minutes. So we were aiming for a 1.5 to 2 minute animation. We then needed to identify an animator, which took quite a bit of effort. We needed, for Bradford University, we needed to obtain 3 different quotations, which meant finding 3 animators who worked in this field, who might be people we could call on. And we actually identified a wonderful animator, Jay Bausch, who has produced some other animations which are on the Young Dementia Network site, who was familiar with Young Dementia Network house style. And he's been very responsive to us and really helpful. So we then needed to agree the key messages that we wanted to give, and we needed to set those key messages into a script that was short enough to be read within 1.5 minutes. So every word in that script had to be worth its weight. And we took feedback, we made changes as we went along in response to the comments of people in the co-production group. And then we were able to pass that on to Jay with ideas for the images that might go alongside that he would animate. And he turned those into a storyboard, sent it to us. We sent it around the co-production group, had a discussion and sent messages back, and he refined it. And you can see one page from an early storyboard here. And then as Jay started to animate, he would send us the draft and we could give feedback. So we could feedback on whether we felt the visual cues were obvious enough, large enough, whether the people looked the way we wanted them to look, and so on. And then finally, we could give views on the voiceover. What sort of voice should we have telling our story? So we'll look at the animation in a moment. But in terms of the short booklet, we wanted to produce this backup information. So we have a leaflet. You can see the cover here. And it covers key aspects of social care for young onset dementia, including under these various headings. We tried to pick out the areas that we feel are distinctive because of the age and nature of young onset dementia. Obviously, people with young onset dementia, 65 isn't a magical age cutoff, and different people have different life contexts. And some literature on dementia generally can be very helpful for social care staff in thinking about needs of dementia. But there are a lot of things that are specific to being younger too, and we've tried to draw them together into this booklet. So we do have a page created on the Young Dementia Network website for information on Dynamic. And as we produce resources and publications, they'll be available here. At the moment, there are several tiles showing the different links that we will have or already have. We have one publication from the project so far, as well as a protocol, but we'll have more coming along, and we'll house links to those on the website too. So that's a story of how we've got to this focus and how we've put together the animation that we're going to show you. You'll see in the animation some of the ideas that came from the earlier steps of the project. So what we'd like to do now is show you the animation and then have time for discussion. So over to Catherine, who's going to click play.
I didn't realise how different dementia is when it's diagnosed at a younger age until I started working with Miriam and her family. They've faced so many issues: early retirement, changes in family dynamics and finances, and the emotional impact on their children. Local support hasn't been easy to find for Miriam, and when it's available, it's rarely tailored for someone her age. Our dementia training barely touched on young onset dementia. I've since learned that rarer dementias are more common in younger people and that the symptoms and challenges can be quite different. I started reading up sharing young onset dementia related resources with colleagues and family members and found a specialist service we could contact for advice. Their guidance made a huge difference. And getting to know what really matters to Miriam helped us find a support that suits her and the whole family. We've put a care plan in place for the family, one that we can adapt as their needs and wishes change. Supporting Miriam has changed how I work. If you work in adult social care, it's crucial to understand the unique impact of young onset dementia. Let's raise awareness and make sure no family faces it alone.
Thank you very much indeed. If Julie comes back on screen. So this is a reminder to people to put your questions in the Q&A. I have a question for Jan, just picking up on that animation and resource. What's your wish in terms of the use of these resources that you've developed, that your team has developed, Jan? What would you like to happen? Jan, you're on mute.
Someone had to do it. Yes, thank you. Well, we would like to try and get word to go round about them. We would like it if, you know, a social worker in practice who gets a referral of someone with young onset and thinks, not sure what to do here, finds the animation. And we think by housing it on the Young Dementia Network website, hopefully that'll help, because if people put young dementia in their search engine, it should take them towards this. I don't know if members of the audience, you know, might, if they have ideas, they might put in the chat how they think we're best to reach them. But that's our ambition, is that it should be easily available. And also to mention that Research in Practice kindly put information about these webinars on their site, and I believe that's a site that's visited quite a lot by social workers who want to find out about the evidence base for their work. Okay,
that's useful to know. May I ask a question of Julie, and then I will go to everyone else's questions too. Julie, somebody in the chat mentioned the work that you're already doing to raise awareness amongst professionals and also with your peers as well. And I wondered if you were sort of routinely or regularly involved with social care workers and the education of and training development. Are you involved at all?
I'm involved regularly with with Bradford University. I'm one of their experts by experience, and just as we've developed the first module at the master's level to be written by people with dementia, designed and written by, then we're also involved in the teaching of that. And just this morning, I've been involved in teaching an online teaching session of that particular module. So yeah, I've got regular ongoing input into that, as well as any research meetings that come up and making those research findings, spreading it across my network to disseminate the information that we gather from our work.
Yeah, brilliant. And so all attendees and all the rest of us need to do as much as possible to share the work that you've been undertaking and the resources and such like. I'm going to go to this is a question I think for either or both of you actually. Is the support for young onset dementia better now due to more awareness? Reason being this was harder to get, that it was in the past harder to get an accurate diagnosis. What's your feeling about that? It does have more profile for sure, but what does it actually feel like living day to day with young onset?
I feel it's when it actually comes to the chalk face level, that there's still not enough. There's difficulty in because of every local authority being in even more financial difficulties than they were, and everybody cutting back. It feels to me like, unfortunately, dementia has been slipping down the priorities list again. And within that, I think that it is a postcode lottery always, but I feel that young onset, for some local authorities, if they feel that they've done anything for dementia or provided any provision, they haven't necessarily thought in terms of anything different for people who have young onset. They're assuming that it's all the same thing for everybody who's got dementia.
Yes, still, yeah. Jan, any thoughts to add?
I would broadly agree with Julie. I think there aren't enough specialist services. Where there are specialist services, they're often very good. But they're often, even where there is a specialist service, people in the local authority adult social care teams may not be connected with that service. So we have the organisational issues and the need for clear care pathways. And I know Dementia UK has been doing some work on young onset dementia care pathways to try and look at ways to bridge those gaps that people fall through and then feel abandoned instead of getting service. And I think there's not enough sustainable funding. You still have quite often short-term projects that come to an end. But one thing I think is, a possible hopeful indicator, Julie says that dementia seems to have slipped down a little bit from, the heady days of it being the Prime Minister's challenge and so on. And we now seem to be being included with other long-term conditions on the health service side rather than dementia being a headline. but there is this push towards shifting from treatment to prevention. And I'm sure a lot of social care staff do want to do things proactively, but actually end up firefighting. But if there is going to be a push towards prevention and it allows social care staff to be more proactive, I think that will be really welcome. Yeah.
Yes, thank you very much. Just thinking of the young onset dementia pathway that you mentioned, Dementia UK and Young Dementia Network have developed with an expert advisory group a framework for a young onset dementia pathway to support ICBs in providing improved pathway and services for people with young onset and families. And that was launched last week. And I think that Catherine has put a link to the framework in the chat, but also we'll add it to the follow-up email.
Can I just put in there that one thing that I found is that, unfortunately, when you're trying to identify, doing a bit of research yourself, that there's not the, there might be registered how many people are living with dementia in a certain area, but there's no further definition as to how many of those people have young onset.
Yes, and then even if you are aware of the numbers estimated to be living with young onset, what type of diagnosis, because that's so important to how life can be lived and the support that's needed, isn't it?
Yeah.
I'm going to test your soap opera watching now. Dawn asks whether you feel that it's portrayed well in TV soap operas. If you're a follower, let me know. What do you think?
I'm not much of a follower and probably should be. I know Claire Mason in our group, I think, has been involved at one point with the storyline of Emmerdale. I did listen to the Archers in the past at the point where, was it Jack, wasn't it, Woolley, who had dementia, but I think that was more late.
That was late onset.
Not
being
young
an Archers fan, that was late onset.
Mm.
But I think Coronation Street and EastEnders both feature young onset, which is certainly raising the profile to a degree. I don't know if you've got any thoughts on that, Julie.
I haven't seen either EastEnders or the Coronation Street storyline. I did follow the Emmerdale one, and the company actually worked very closely with Bradford, because you're going to have to remind me of the name of the actor who played Ashley. But his hometown is Bradford. So he came back to Bradford and worked with the university on working with their experts by experience with young onset. And I know that Claire, when they first got the scripts, Claire told me that they had one look at the scripts and went, oh my God, no. Because what they planned on doing was taking this well-loved, established character, Ashley, delivering him with a diagnosis of young onset. And then I think they were going to kill him off in about 6 episodes. And they were going, no, we can't do that. So they were able to persuade the company to slow the pace and be more realistic.
Yeah, okay.
One thing I was just going to add was that although it's not about whether portrayal is accurate, in some other work we've been doing with people from diverse ethnicities, people of a South Asian background have said that the soap operas, the community radio and so on are very good ways of passing on information through the South Asian community.
But we do find that a lot, it is very difficult to get the media to change the vocabulary that they're using. So we've worked between ourselves and Bradford on particular work textbooks where vocabulary has been targeted as a very important part of reducing stigma. And yet, if you look through your newspapers or online, you still hear about people with dementia being referred to as dementia sufferers or dementia patients, when, I'm not a patient that's sat here now. I'm Julie. I just happen to be living with dementia. I'm not a patient until I'm in hospital or I'm in the doctor's surgery.
Yeah. So, I mean, just bringing it back to social care, which is so important in enabling, life to be lived as fully as possible.
Mm-hmm.
The language there is also very important, isn't it? It's important for any professional involved, and to be using language that nurtures and respects, and all of those really valuable things that keep us going. I'm just going to quickly respond to young onset is preferred to early onset now in terms of young onset dementia. It avoids the confusion with early stage.
Mm-hmm.
So that's why it's used. But also, there's another question about when it could start. And young onset is considered to be young onset if the symptoms emerge under the age of 65. And there's a reasonable consensus on young onset and under 65 currently, and so that's what's in use. Question: could this video be used in the colleges for students who may go on to become social workers for the future? So this is somebody who's working, Deborah, who's working with healthcare college students in delivering dementia awareness sessions. Seems very
That's a
appropriate.
lovely
What do you think?
suggestion. Isn't that a lovely
I
suggestion?
think that would be really good because, it's a while ago since I trained as a social worker, but dementia wasn't even touched on. And even when I went on to specialise in older people's services, community services, I was never given any training at all in dementia, even in older people, so young onset. I don't think before actually having my own diagnosis, I don't actually think I'd ever heard of young onset. I was that ignorant.
Okay.
Yeah, I think when I was involved in training clinical psychologists, videos were popular. And if you've got quite a long talk session, it's really nice for students to be able to have a bit of variation and watch something for a little while.
Yes.
And I mean, the video will have the link on the Young Dementia Network website, so it will be available for people to use.
Yes. That video and any other video that you see on the network site is absolutely for everybody's use, and please do. So please, attendees, share the resources, show the animation, get the word out there to all other interested parties, social work colleagues. In the meantime, I'm going to sort of close up, unless Jan and Julie want a last word.
My only last word would be to just acknowledge the input of everyone who's made it possible to get this far with it. It's been a great team, and I hope that the video will be useful and be watched.
Thank you. Thanks very much. Julie?
Thanks to everyone who's come along today, and it will be really useful if any of the things that you pick up from the work that we've done, if you could please try and disseminate it out to your own networks. That would be really good.
Yes, brilliant. So thank you, Julie and Jan, and all the dynamic team as well. Really appreciate the contribution to this webinar, and thank you to all attendees. The follow-up email will contain all sorts of bits and pieces that are important to be able to disseminate. Our next webinar date is 19th November, and Jan mentioned that, and that's about enabling social care, how social care can enable families affected by young onset dementia to both plan and cope with the financial challenges that people with young onset particularly face. So that will be a really interesting one, I think, for us, and that also will have animation resources and such like attached to it. So for now, thank you so much, everybody. And yes, hope to see you in November. Bye-bye.
Bye.
Bye. Bye.